Welcome to your channel name. Today we're diving into a topic every new mom can relate to: breastfeeding and sleep. We all know how crucial sleep is for both moms and babies, but finding the right balance between night feedings and restful nights can be challenging. In this video, I'll share practical tips and expert advice to help you navigate those nighttime feeds and create a routine that works for both you and your baby. Don't forget to subscribe to the channel and hit the notification bell for more parenting tips and insights. Let's get started. One of the first steps to better sleep is understanding your baby's natural sleep patterns. Newborns typically sleep in short cycles of 2 to 4 hours, waking frequently to feed. This is completely normal and ensures they're getting the nutrition they need. During growth spurts, babies may wake more often to feed. These periods usually last a few days, but can disrupt sleep temporarily. Look for signs of sleepiness, like rubbing eyes or yawning, to avoid overtiredness, which can make falling asleep harder. What's one thing you've learned about your baby's sleep patterns? Share it in the comments. It might help another mom. Having a consistent nighttime routine can make night feeds easier and more manageable. A warm bath, gentle massage, and a quiet feeding session can signal to your baby that it's time to wind down. Keep lighting low during nighttime feeds to maintain a calm environment and help your baby stay sleepy. Offer extra feeds during the evening to help your baby stay full longer at night. Do you have a bedtime routine that works well for your family? Let us know in the comments below. Choosing the right breastfeeding position at night can make feeding more comfortable for both you and your baby. The sideline position allows you to feed while lying down, making it easier to rest during the feed. Reclining slightly with your baby on your chest can be comfortable and prevent swallowing air. Use pillows to support your arms and back during feeds to reduce strain. What's your go-to position for nighttime breastfeeding? Share your experience in the comments. Your rest is just as important as your baby's. Here's how to make sure you're getting enough sleep. Even short naps during the day can help you recharge. If possible, have your partner help with diaper changes or soothing between feeds to give you more rest. If you choose to co-sleep, follow safe sleep guidelines to make it easier to nurse and rest simultaneously. What's your best tip for catching up on sleep as a new mom? Let's share advice in the comments. As your baby grows, their sleep needs will change. Here's how to handle the transition. Around 3 to 6 months, many babies start sleeping for longer stretches at night. Slowly space out feeds as your baby becomes more capable of taking in more milk during the day. Every baby is different. Some may continue to wake for night feeds longer than others, and that's okay. Have you started transitioning to longer sleep stretches? How's it going? Let's discuss in the comments. Breastfeeding and sleep can feel overwhelming, especially in the early months. But with patience, consistency, and the right strategies, you can find a rhythm that works for your family. What's one tip or trick that's helped you manage night feeds and get better sleep? Share it in the comments below. It could make a big difference for another mom. If you enjoyed this video, give it a thumbs up and subscribe for more parenting tips and advice. Check out my other videos for more insights into making motherhood a little easier. Thanks for watching, and until next time, rest up and cherish those sweet nighttime moments with your little one.